So let's talk about some of the ongoing clinical trials that are being used for Parp inhibitors. It's a very exciting time in recurrent ovarian cancer. We talked about moving Parp inhibitors frontline, SOLO-1 with olaparib, PRIMA with niraparib, the combination of bevacizumab and olaparib and payola. But in recurrent disease, we have a second opportunity other than maintenance, and that's treatment. And you presented at ASCO 2018, Katie, a wonderful study called Quadra. Tell us about Quadra and what the key findings were.
So thanks. So Quadra is a really unique trial. It's actually the biggest treatment Parp trial run, 463 patients. The primary outcome of this trial was to look at the overall response rate of niraparib in patients who were in their 4th or 5th line of treatment, who were still considered sensitive to platinum. Doesn't mean they got platinum as their last line, but they're still considered sensitive to platinum, and were HRD positive. So that was the primary group. It enrolled patients 4th line and beyond, HRD positive and negative, BRCA positive, so those could be looked at secondarily, but that was the primary endpoint. And what it found is in this relatively heavily pretreated group of patients, the overall response rate was 29%. If you included those patients who were in 6th, 7th, 8th line or whatever, it was 27%, so you actually didn't lose a whole lot of efficacy. Of the BRCA patients who were enrolled regardless of platinum sensitivity or just regardless of platinum sensitivity, those who responded, the duration of response was almost 10 months. In the HRD positive group, it was 8.4 months. So this is one of the first trials, big trials, to, outside of phase 1 expansion cohorts, to look at patients who had been very heavily pretreated and look at the efficacy of Parp inhibition. And so for that reason, it's a very unique and exciting trial, and speaks to the benefit of Parp in an area where we talk about using Parp early, which may be true, but Parp's still active late on.
In this 460 patient trial, congratulations again. I'm struck that it confirms our knowledge about what the predictors of Parp sensitivity are. You kind of said, so the molecular signature HRD, okay, platinum sensitivity, and the number of lines of therapy. So when you start to fill out those boxes, molecular signature, platinum sensitivity, and number of lines of therapy, you can kind of get a sense, well, this would be impactful. And kind of at the lower end of the spectrum, it's about 10%. Heavily pretreated, 4, 5, 6, 7, 8 lines, platinum-resistant molecular signature. 10% isn't great, but some of those patients have durable responses. And in the better population, maybe 4th, 5th line HRD positive sensitive, it's 30%. So it really reinforces our understanding of the biology of this. So congratulations.